Ever confused heartburn with a heart attack? You're not alone. It's surprising how often these two vastly different health conditions get mixed up. It's easy to see why. They both strike in the chest area and can bring on similar discomfort. But here's the thing. Understanding the difference between the two could be a matter of life and death. It's crucial to know how to distinguish between the symptoms of heartburn and those of a heart attack. Why? Because this knowledge could mean the difference between rushing to the emergency room or reaching for an antacid. It could mean the difference between life-saving, timely medical intervention and, well, you get the picture. And that's exactly what we're going to delve into today. We'll be exploring the unique characteristics of both heartburn and heart attacks, and how to accurately differentiate the two. So, if you've been struggling to differentiate the two, stay tuned. Heartburn, despite its name, has nothing to do with the heart. It's a digestive issue that occurs when stomach acid backs up into the esophagus, the tube that carries food from your mouth to your stomach. This backflow, or acid reflux, can damage the lining of your esophagus, causing inflammation and a burning sensation in the chest. Now let's dive deeper into what causes heartburn. The primary culprit is often the foods we eat. Certain foods and drinks, such as chocolate, citrus fruits, spicy foods, fatty foods, onions, garlic, peppermint, alcohol, or caffeinated beverages can trigger heartburn. Eating large meals or eating late at night can also cause heartburn. But it's not just about what you eat. Certain lifestyle factors can also contribute to heartburn. These include being overweight, smoking, and even certain medications. Now that we understand what heartburn is and what causes it, let's talk about the symptoms. The most common symptom, as we've mentioned, is a burning sensation in the chest, often after eating. This burning sensation can last for a few minutes or a few hours, but heartburn doesn't stop at your chest. It can also cause a sour or acidic taste in the mouth. This is because the stomach acid that's backing up into your esophagus can reach your throat, affecting your taste buds. Another common symptom is difficulty swallowing. When the lining of your esophagus is irritated by stomach acid, it can cause a sensation of a lump in your throat, making it difficult to swallow. So the next time you feel a burning sensation in your chest, a sour taste in your mouth, or difficulty swallowing, remember these could be signs of heartburn. Identifying these symptoms can help you understand when you're having heartburn and not a heart attack. Understanding these differences is the first step towards timely intervention and maintaining a healthy life. When it comes to heart attacks, every second counts. So let's delve into understanding what a heart attack is. In medical terms, it's known as a myocardial infarction. This occurs when blood flow to a section of the heart muscle becomes blocked. If the blood flow isn't restored quickly, that area of the heart begins to die. It's a serious medical emergency. Now you might be thinking, why does this blockage occur? Well, it's usually caused by the buildup of fatty deposits on the walls of the arteries. These deposits are often a result of unhealthy lifestyle choices, such as a diet high in saturated fats, lack of physical activity, or smoking. Over time, these deposits can narrow the arteries, making it difficult for blood to flow through. If a piece of this fatty deposit breaks off, it can cause a blood clot to form, blocking the artery and leading to a heart attack. Let's talk about some of the common symptoms. The most well-known is chest discomfort. It's often described as a sensation of pressure, squeezing, fullness, or pain in the center of your chest. This discomfort can last more than a few minutes, or it may come and go. But a heart attack isn't always announced with chest pain. You may also experience shortness of breath, even without chest discomfort. This can occur when your heart isn't pumping blood efficiently, and your body struggles to get the oxygen it needs. Discomfort can also extend beyond the chest, to other areas of the upper body. You might feel pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other symptoms could include breaking out in a cold sweat, nausea, lightheadedness, or feeling unusually tired for no apparent reason. These symptoms can occur in both men and women, but it's worth noting that women are more likely to experience some of the less typical symptoms, like shortness of breath, nausea or vomiting, and back or jaw pain. Recognizing these symptoms can potentially save your life. Knowing what to look for is the first step in taking timely action. So stay informed and stay healthy. Now that we know the symptoms of both conditions, how can we tell them apart? We've journeyed through the landscapes of heartburn and heart attacks, understanding their unique characteristics. Now we're at a crucial juncture where we need to differentiate between the two. This is vital because the course of action for each is quite different, and in the case of a heart attack, time is of the essence. So, let's dive right into it. One of the key differences between heartburn and a heart attack is how the symptoms respond to rest and medications. Heartburn symptoms tend to ease up when you take antacids, or when you change your posture, such as standing up from a lying position. On the other hand, the symptoms of a heart attack are relentless. They persist despite rest and do not improve with a change in position. Also, heartburn symptoms are often triggered by certain foods or drinks, such as spicy foods, alcohol, or coffee. If you notice that your discomfort tends to flare up after certain meals, it's more likely to be heartburn. In contrast, heart attack symptoms can occur at any time, with no apparent triggers. Another distinguishing factor is the nature of the pain. Heartburn usually presents as a burning sensation, hence the name, and it's primarily felt in the chest, but it can also radiate to the throat. However, heart attack pain is typically described as pressure, tightness, or a squeezing sensation, and it can radiate to other areas like the arms, neck, jaw, or back. In addition, heart attacks may be accompanied by symptoms that are less common with heartburn. These symptoms could include shortness of breath, cold sweats, nausea, lightheadedness, or sudden fatigue. If you experience these symptoms, especially if they come on suddenly and are severe, it's essential to seek medical help immediately. But remember, each person is unique, and so can be the presentation of these conditions. It's not uncommon for symptoms to overlap or for heart attacks to present with atypical symptoms. Sometimes, heart attacks can even occur without chest pain, especially in women, the elderly, or people with diabetes. So while these guidelines can be helpful, they're not foolproof. If you're in doubt, it's always safer to seek medical advice. It's better to err on the side of caution than to risk missing a potentially life-threatening condition. Knowing these differences can help you decide when to seek immediate medical help. In the end, the key takeaway is this: listen to your body. It's the only one you have, and it often sends signals when something is not right. Understanding these signals and knowing how to differentiate between heartburn and a heart attack can be life-saving. So keep this information handy, share it with your loved ones, and let's all aim for a healthier, heart-happy life. In conclusion, understanding your body and its signals is crucial. It's like learning a new language where the words are sensations, discomforts, and pains. The more fluent you are in this language, the better you can respond to your body's needs, and often, the healthier you can be. Let's revisit the topic at hand: heartburn and heart attacks, two conditions with symptoms that can be easily confused. However, their differences are significant. Heartburn, primarily a digestive issue, usually presents with a burning sensation in the chest or throat, often after eating. It can be uncomfortable, but it's generally not life-threatening. On the other hand, a heart attack is a cardiovascular emergency that requires immediate medical attention. Its symptoms can range from chest discomfort and shortness of breath to cold sweats, nausea, and lightheadedness. Remember, a heart attack can be silent, with symptoms so mild that they're easily dismissed. That's why it's paramount to be vigilant and proactive about your health. If you experience symptoms that could indicate a heart attack, don't delay. Every second counts. Reach out to medical professionals who can provide you with the right guidance and care. Staying informed is your first line of defense. The knowledge you've gained today about heartburn and heart attacks can help you differentiate between the two, enabling you to seek timely intervention when necessary. Your health isn't something to gamble with. It's your most valuable asset, and it deserves your utmost attention and care. In the end, it all comes down to one simple yet powerful mantra: when in doubt, it's better to be safe than sorry. This applies not just to heart attacks and heartburn, but to every aspect of your health. Remember, when in doubt, it's better to be safe than sorry. If you found this video helpful, don't forget to subscribe, like, share, and comment. Your health matters. Stay informed, stay safe.